In progress.
Okay, so we'd like to welcome everyone to our Board of Health meeting today on August 9th. Check my calendar for that. It is 6:08 p.m. now that we've figured out where we are and where we're supposed to be. I'd like to recognize members of the public who are joining with us. And how do we do questions and comments in this format?
So
raise the hand icon.
So I'm going to, let's see.
Yeah, if people go down to reactions, there's a place there where you can digitally raise your hand. And then that might be a good way to let you know, Jeff, that they're wanting to ask a question or comment.
Reactions, I'm not even sure where that is in this new platform.
It's down the bottom on the right.
Bottom right.
I'm sharing my screen, so I'm seeing something different. Are you sharing the seeing the agenda?
No, we can still see it. It should be, people should be able to see it. It's at the bottom of their
Click on the bottom of the screen and then the bar will come up.
Another way they could do it if you want, Stephanie, is there's the chat
right
button, and people could say like, hey, I'd like to say something. And
okay, yeah. So we'll watch for those two options. And Jeff, is there any way you can make the agenda larger?
I believe I can.
Because
let's try it.
The eyes are going.
Thank you. All right. So
Joanne's trying to get in and having trouble.
Okay. So our first item on the agenda is open forum. And we have on that a recognition of Gail Johnson for receiving the MA-PHN Presidential Award. Jeff, is there more to tell us about that?
Gail received that award for incredibly hard work with MA-PHN. She was nominated by her peers, and it's quite an honor for her to get that. It's given out to very few people really in the area, so we're very lucky that Gail was able to get that. So that's what I have to say about that. We're very proud of how she's done, very proud of the things that she's done, and she's going to continue to do great work for the town of Westford.
Thank you, Gail. Do we have other open forum?
Actually, yes, we do. And I will share this with you. As some of you may know, this will be my last meeting of the Board of Health. I have been offered a position in my hometown, which was quite an honor. And after going back and forth and making some very, very tough decisions on whether I wanted to take that job, I elected to be able to be closer to my family and be able to work around my house again. And it's the hardest decision I've ever had to make professionally, to make a decision to leave a town, because this place is just absolutely fantastic. So it was very mixed emotions and very hard to do, but it's been an honor to spend the amount of time I've been here, the little over 6 years. It's been great. And the board will have some decisions to make on what they would like to do moving forward.
Will we address that?
Well, that's something that I think maybe at the end of the meeting, you should be able to address with some of the correspondence. You may need to discuss whether you want to have a committee to look at that, to how you are looking to have a replacement. You may want to put in a person to fill in. There are people in the office that may be interested in doing so for the time being until you make a decision. I know we've got one staff member that's made mention that she's very much interested in an interim position. So that may be something you would like to look at and recommend with a 2-person committee.
Okay. And I see that, well, Jeff, I don't know if anybody else has anything to say other than.
Oh, Stephanie, I just want to say it's been an honor working with you, Jeff. We've worked closely together on a lot of different issues over the years, and I wish you the best of luck moving forward. I think you brought so much professionalism, so much of your heart to the town, and it's going to be hard to see you go. You're going to leave really big shoes to fill, but I really do wish you the best.
Thank you very much. I'm excited, but at the same time, this is a great town, and I'll miss everybody.
Well, I would certainly second that, Jeff. You've been great to work with. You've had such enthusiasm for the position and for all of the projects that you've undertaken, and we are going to miss you.
Thank you very much, everyone.
And thank you, Jeff, for all the support you've always given me around the mental health issues. And I pray that whoever takes over for you carries on, because it's been very much appreciated.
Thank you. It's been absolutely fantastic.
Yeah, Leominster's gain is definitely our loss.
So additionally, in open forum, I do have, I know we had one person, Kathy Lynch, that wanted to.
Yes, I see her hand is up. And Joanne says she's still trying to get in.
All right, I will, if you can unmute Kathy, I will try to find Joanne.
Okay. I think she's unmuted.
Just unmuted.
Hi, Kathy. Do you want to give your name and I guess address? Do we still do that on Zoom?
Sure. You can hear me well, I hope?
Yes.
Yeah.
Okay. Good evening, Board of Health Department, Jeffrey, fellow Westford residents. My name is Kathy Lynch on Rush Road. I am the Westford Republican Town Committee Chairwoman. I am also the Republican State Committee Woman for the 1st Middlesex District, representing the city of Lowell and 5 towns, including Westford. I recently served 2 years on the Healthy Westford Committee. In speaking with colleagues and constituents, I am hearing very strong objections to news reports about mask and vaccine mandates. I'm taking this time to share my stance and news you and Westford residents may not have heard. Regarding masks, I find it heartbreaking to see precious children with faces hidden, unable to breathe freely, and unable to see facial expressions that are vital for communication and child development. The mask is a cover that incubates germs, fear, and suspicion of others. Immune suppression, bacterial, and fungal infections are just a few more unhealthy aspects of wearing masks. Regarding vaccines, they are risky. As of July 30th, the Vaccine Adverse Event Reporting System, abbreviation VAERS, a national early warning co-managed by the CDC and FDA, there have been over 12,000 deaths, 46,000 hospitalizations, and 92,000 office visits after people succumbed to taking the COVID shots. What makes this number more alarming is that VAERS admits that the numbers reported are just a small fraction of the actual numbers. Health rights is a nonpartisan human rights issue. It is imperative that individuals be fully informed about the risks and benefits of any medical intervention, to include PCR pool testing, temperature checks, vaccines, quarantines, and masks. Parents of guardians should then choose whether or not their child will participate in this intervention. Without informed consent and the ability to opt out of any health intervention, a dangerous nanny state health tyranny would ensue. We must not have that in Westford or any town in America. As state committee woman, on June 9th, I submitted to all representatives of the Massachusetts Republican Party thousands of petitions from Massachusetts residents against mask mandates and a resolution to change the Massachusetts mask mandate that Governor Baker declared in 2020 to a voluntary mask advisory. The resolution passed unanimously. Fortunately, the governor lifted the mask mandate this summer. He is now only making a recommendation about wearing masks if individuals so choose. Senate Bill 1122, an act relative to bodily autonomy and family integrity, addresses health freedom by stating, no person shall be compelled by law to acquiesce to medical treatments or procedures, collection of specimens, or sharing of personal data or medical information. A person's fundamental rights to privacy, travel, and speech afforded under the United States Constitution shall not be infringed upon to impede the making of decisions for themselves or for their dependents, including but not limited to health and medical care. I call on all legislators, including our District Senator Kennedy and State Rep Arciero, to back this bill. No law or policy should interfere with the free will of Massachusetts citizens to make their own health decisions, period. In conclusion, I call for the Westford Board of Health and Health Department to reject any mask, vaccine, or other medical intervention mandate, or simply set voluntary advisories. Advisories should apply to children, staff, and members of the public in our schools and businesses in any indoor or outdoor setting. Declared health emergency orders should never bypass our Constitution and right to choose a health intervention that itself contains risks. And no one should be coerced, harassed, or sanctioned because of their health decision. Thank you for your time and attention.
Thank you, Kathy.
Madam Chair, can I respond?
Yes, Zach.
I just have a question, Kathy. I want to make sure that people watching today are clear that the VAERS system that you're talking about is a voluntary system. So anyone can report. It's a passively collected data system. And so the numbers that you cited there are just basically a database of collected numbers. You can submit those numbers if you're a doctor. You can also submit those numbers if you're just a person. There's no requirement on it, and there's no checking. So you can be a patient, a family member, and so I just want to be clear that is not, the CDC does run the VAERS system, but it is just a database, and it doesn't mean that it's a verified database.
Thank you, Zach. That's correct. Are there any?
I don't want you all to dismiss the fact that people, doctors included, and the CDC and FDA are aware of this, that parents and people that are injured, they report there, and it's very underreported. So that means that the numbers that are reported here are vastly higher.
So, Kathy, I appreciate what you're saying. I also think that there's perhaps a bit of a misunderstanding of what VAERS is. It's a place where you can report. It does not mean that those are confirmed reactions or situations. It's used to then suss out and examine scientifically which ones are in fact linked to the vaccine, but just because they're reported there does not mean that those reactions are in fact linked to the vaccine.
Okay, and it doesn't mean it isn't either.
Correct. Thank you. Okay, thank you. If you would like to send your comments, it sounds like they were perhaps written up. I would appreciate being able to look them over.
Yes, I will. Thank you.
Thank you. And I will check my town email. I have been on summer phase a bit here lately. I don't see any other hands up. I think we're not going to take our COVID updates out of order. We will move to our approval of minutes. Did anybody have any comments on the minutes? I did not see anything.
Stephanie?
Yes.
Okay, you can hear me. I'm just checking. I'm using a different computer and I turned the camera on real quick and it was really weird. So I'm going to try to turn the camera, keep the camera off unless you really need to see me. But okay. I want to make sure you could hear me.
Yes, we can hear you. Thank you, Joanne. Does anybody have any comments on the minutes?
The minutes look good to me.
And is somebody like to make a motion to accept the minutes from the May 10th? No, these are the
June 14th.
June 14th.
I'll make that motion.
Motion made.
No, second.
Zach seconds. Okay, all in favor, please say aye.
Aye.
Okay, so motion passes unanimously.
Wow, I got through my last meeting with no corrections, finishing on a high note.
They were very good. All right. And then I didn't bring two computers, and I didn't want to print the paper. So thank you for scrolling back up. So now we have the appointment of the board officers.
Stephanie, can I just chime in on this real quick for a quick explanation why, even though it's my last meeting and I'm being reappointed, or at least if you're going to reappoint me, you need somebody appointed for the entire time until an employee is no longer an employee. So until such time that my last day on the 1st of September is, we technically still have to have those positions appointed. And when you replace me with a new director, you'll then reappoint that new person.
Okay, thank you. So currently I'm serving as the chair and our vice chair is Zach.
I believe so.
And Joanne, are you secretary?
No, that's me.
Oh, Michelle is, okay.
Joanne won't take it under duress.
No. I'm not a good secretary.
I'm happy to remain secretary if you guys want me to.
Okay.
I would love to renominate you, Stephanie. I think you've done a fantastic job. I don't know if you have the time or energy for it. I know it is some extra work, especially if we're going to be forming a new committee, but I'd love to nominate you if you're available for the position of chair.
Thanks, Zach.
I will second that.
Okay.
And I would third that.
You guys have put a lot in, and I do have perhaps a little bit more time than many of you, so I am willing to do that another time. Although I am up for election this year, so. Okay, and vice chair?
I say we keep Zach. I nominate Zach.
You willing, Zach?
Thank you. I'm happy to do that if you would like me to do that.
Okay, great.
Second the nomination then.
All right, so can we do it as one motion to accept, or does it have to be individual ones?
I think you could motion the entire slate for all the positions
Okay,
in one vote.
okay. So we would have, so somebody want to state that and make that full motion?
I'll make a motion that we accept the slate of Stephanie as chair, Zach as vice chair, Michelle as secretary, and the appointments as listed.
Okay.
I'll second that.
And seconded, thank you. All in favor, say aye.
Aye. Aye.
Joanne, are you an aye?
Yes.
Okay, sorry, I just didn't hear it. Just want to be clear for the record that it was motion passed unanimously.
Yes.
All right.
Thank you, Stephanie.
No, thank you to you and Michelle for willing to continue to. So we're dismissing our next agenda item till next month, we believe. Is that correct?
Yes. So the reason is we had sent some things to KP Law. We're waiting for some responses, and in the process, the people that own the property are happy with waiting because there are some things they just want to make sure they're ironed out, because what they're asking for is new and different. They want to make sure it's right. So they're going to wait one more month to go to, I believe, the 13th of September, which isn't going to change their timeline on what they're doing for the most part.
Okay.
So they're off.
Okay. So seeing that, we will dismiss that item or table that item till next month. And then the next agenda item is the Westford Health Department to propose revisions to the Westford Food Code Section D. Adding the word architectural.
Yes. Just make this a little bigger. So I'll just give you, and the reason why we don't have Ray Dick here today is she's actually on vacation with her family. So I will be giving you the rundown of what Ray and Arnie and Abby have been working on, and a pattern they were seeing with what's happening with having a CPFS initially look at plans They were having the CPFS look at plans and stamp them as we asked them to do when they were doing plan reviews. But what was not happening is the CPFS, or it could be an RS if it's done as well. They were not seeing the process to the end because they only had to stamp the plan. And what we were seeing as we were getting good plans and the cut sheets were right and all that good stuff was there. But we were seeing us having to go back 3, 4, and 5 times for things they were not identifying on the plan that was certified. So what we have done is we have asked, we're asking for you to vote on these revisions to the Westford Food Code that's going to require the restaurant to keep their CPFS person on for the entire process from the beginning to the end, so they can make sure that when they call the health department in, they're only getting 1 inspection. They're not getting 3 or 4 and wasting our time, wasting their time, and in some cases, slowing the opening of the restaurant. So what this language is going to do is the plan review and permit applications, architectural plans, and all other accompanying documents must be reviewed by the registered sanitarian, a food safety consultant, or a certified professional food specialist. Sorry, I was letting somebody in that was looking to come into the meeting. The food safety professional chosen and hired must be present for any necessary pre-operational meetings and inspections. And what that is going to do is it will cost the restaurant a little bit more to have them there for those inspections. But what it will do is it will remove the need for us to be there as many times, and we'll get the restaurant open sooner. We've had a couple of instances, one of them being our newest Mexican restaurant where we had to go back 3 and 4 times and they weren't quite ready for us. This will eliminate that need and we should get places open sooner. We think the language is pretty basic. It does what we need, and we're satisfied with how it'll work. We've run it by some food specialists and other RS people to see how they feel about it, and it does make a lot of sense.
Sue?
Are other towns doing this, Jeff? Like, are other towns requiring this?
We're the only ones that we're aware of that are doing this, but we're also the only ones that have our local food code that we're using as well. So we feel that we're a lot more progressive, and we feel that we're getting places where they want to be faster than they would in other places. So we feel like we're just getting that hand-holding piece really tight and just getting them ready sooner to get places open.
Zach?
I'm all in favor of this. Just a couple of quick questions, Jeff. One is, so adding the word architectural, that's enough to tell them what you needed to see that you weren't getting before? Well,
what we don't want to see is, we don't want to see plans drawn on like an 8x11 piece of paper. And we basically don't want to see crayons and people drawing things that really don't make a whole lot of sense. We want somebody with architectural skills putting in where the dishwashers go, where the doors are, where the hand wash sinks are, the heating and cooling pieces, the cooking pieces, the islands. So we know where all those things are. Sometimes if you don't have an architectural plan like that, people forget what they're actually going to need.
So is it safe to say that actually in many cases it sounds like it will probably save the applicant money because they won't miss something that they needed and then have to go back and redo it?
Yeah, and it could save them a significant amount if it even meant something like jackhammering a floor where they had to put a drain in or they didn't have a sink where they needed one. So this would eliminate some of those fears or allow them to design to what the building constraints actually are and be the most effective they can be.
Great, thank you.
I'm sorry, go ahead, Zach. I was going to say, have you had any feedback from restaurants at all?
Where this is so new, we haven't, but where we just went through a round of inspections with one restaurant where it was pretty clear that they needed somebody and they knew it. This will make a lot of sense for people that really need to have somebody holding their hands. there are a lot of people that are absolutely fantastic chefs that can do a fantastic job cooking, but to run a kitchen safely, sometimes they just need that little extra help.
Thank you. Any further discussion? Would anybody like to make a motion to accept these proposed revisions?
I'll make the motion.
Sue made the motion.
A second.
Zach seconds. All in favor?
Aye.
Aye.
Again, Joanne, since I can't see you and I don't hear it.
Yes.
Yes, okay. Then the motion, and Michelle, I didn't actually see you also. You're off my screen. Did you say yes?
Yeah.
Okay, so the motion passes unanimously. Thanks. Sorry, I only have, now Jeff is gone, so. Okay, and so now we'll move on to probably what most of our guests are here for, which is an update on the current COVID-19 cases in Westford and statewide recommendations, and a discussion of what we would like to make in terms of recommendations at this point.
Sure. So currently our COVID-19 cases in Westford sit at right around 20. As of Wednesday afternoon, when we ran our numbers, we had, of those 20, about 6 of them were kids. Got people chiming in, just moving them along. 6 of them were kids, 3 of them were age 3 and under, and the other ones were school age, probably somewhere between the age of 11, 12, and 13. Everybody that we have that's gotten COVID that we can tell in Westford right now has gotten it traveling, or they've received it from a family member. Many of our cases are linked to other family members in people's houses. We've been sitting kind of steady since this spike started about 3 weeks ago, right at around 20 cases a week. It's been just kind of hovering right there. It hasn't gone up, hasn't really gone down. So that's where we kind of sit locally. We do know that within that, many people have been vaccinated, so there are some breakthrough cases, but some of them haven't been vaccinated either. So the people that we're seeing that are vaccinated, that are getting it, for the most part, they are not extraordinarily very sick. Some of them are asymptomatic. They are breezing right through what their quarantine and isolation period would be. And they're getting better.
Can you, Jeff, remind everybody of what that quarantine period would be and isolation? Because it's been a little while and things have changed.
Sure. So quarantine is typically for a person that's a contact, and that contact has to operate on a couple of different levels. If you don't want to get tested to see if you're negative, you're going to be quarantined for 10 days. That's if you're symptom-free and you don't have any illness whatsoever. If you become sick and you don't wish to test, you're going to be quarantined for 14. If you wish
sorry, Jeff, you said 2 things. First you said 10, then you said 14.
Right.
If you're not tested, it's 14?
If you're not tested and you actually have symptoms, it's 14.
Oh, with symptoms. Okay.
Yes. If you are symptom-free, and I had to look at some of this stuff up again because we've been so long since we actually had to deal with it. If you wish to test out of quarantine sooner, you can test after day 5. And if you are negative, you can be released from quarantine on day 7.
Day 8.
Day 8, you're out. Day 7, you're done. Correct.
Right. That's right.
Isolation is different. Isolation, if you are actually COVID positive, you are isolated for 10 days, or I believe, Sue, it's 2 days after your symptoms resolved, whichever is longer.
But I believe, and Joanne, you would know this too, I think there is actually an option to come out of isolation early. They don't talk about it very much, but if you do get 2 negative tests within 24 hours apart, you can come out of isolation early.
Is that new?
No, that's something that people that were asymptomatic and didn't really believe that their test result was true, which is, they gave them that option. That was on those webinars. And they don't talk about it, like it's not, but it's said, if you go through, again, it has to be a PCR test. So if you get a positive PCR test and then you have no symptoms, if you have symptoms, forget about it. You're asymptomatic and you get another test and then 24 hours get another test and both of them are negative, you can come out of isolation early.
I think that may be on a case-by-case basis, Sue, but not as part of the general criteria for what you're telling people in an isolation situation. But I did remember hearing something about one particular case where a single person didn't think they were truly positive, and they got a second PCR test and it came back negative, and the state did accept it.
Well, two negative PCR tests, yeah. Two negative after a positive.
So I think there have been cases where that's happened, but as part of the general protocol, I don't think we're telling people that, because that's a lot of information. And
yeah, no, I know. So I have a question for you though, Jeff. And I know I'd asked you this before, but so the breakthrough, those people that are breaking through, do we know whether they've had Moderna, Pfizer, J&J? Like, is there a way that we're getting that information, or is the state tracking that at all? Do you know? Or because I know in the system, everybody who's been vaccinated, it goes into this system and we know what they've had, but I'm just curious about at the state level, are they tracking the breakthrough cases and seeing whether it's a certain vaccine that is causing the breakthrough?
So I don't know if MIIS and Maven are able to use both of those groups of data.
Yeah.
But I do know that you could track what somebody got through MIIS. You would have to cross-reference each person, I believe, and Joanne can speak to that as well because she's on MIIS all the time. I think you would have to cross-reference each person to see what they actually had, which would, quite frankly, be, in my opinion, a ton of work.
Oh, yeah. I just know that I talked to somebody who had a breakthrough case, and she was sick, and she had the J&J, and her husband had the Moderna or the Pfizer, and she got pretty sick. She was sick for about 3 days, and he was asymptomatic. So I was just curious,
So the state is tracking that through Maven. They have a system whereby, as these cases come through that have been previously vaccinated, there's a trigger in Maven and they do look at them.
Okay.
But the thing to remember is that no vaccine, nothing in life besides death and taxes is 100%, correct? And in all vaccines, we expect this to happen. So this isn't anything that is unexpected in terms of the COVID vaccine with any of the formularies. And I have not heard or seen that they're targeting one over the other, that, there was particular issues with breakthrough. But, it's one thing that we want to be very careful about, that it's not happening unexpectedly, but it's also not happening in huge amounts, and that the vaccine is still doing its job, in that anyone who was previously vaccinated and then actually, does come in contact and develop COVID, the vaccine is preventing those hospitalizations and deaths that are associated with non-vaccinated people. So even though we keep talking about breakthrough, the vaccine is still doing its job in keeping people, when we talk about morbidity and mortality, we're keeping the disease rate out of the hospitals, at least around here. And, obviously, although the deaths that we had to experience earlier on are not associated with this right now. So it's a conversation. It's a tricky conversation because we still want people to get vaccinated.
Yep, absolutely.
And thank you. There is clearly a difference between those who are vaccinated and getting COVID and those who are not vaccinated and getting COVID in the rate of hospitalization and the symptoms experienced.
Right.
We have a couple of people who would like to make a comment. First, Jody, and then I have comments from Catherine Clear and Jennifer Bolu after that.
Hi, thank you. Can you hear me okay?
Yes.
Thank you. So I am concerned, you're meeting remotely, but many boards are meeting in person and the meeting rooms are tight. I have an upcoming meeting in September that has school committee, select board, finance committee, and permanent town building committee all in the same room, along with then residents and others who are interested. So I am concerned about it because we have done such a good job of protecting people. And I am concerned because, what we've learned is even if you're vaccinated, you can transmit the virus. And so I guess I'm curious what the Board of Health's recommendation is on that. We have been working towards a hybrid type meeting, which we'll be trying out tomorrow with the select board. It's more complicated than virtual, but it definitely is a concern of mine. Not only, you said that vaccinated people typically don't get as ill, but many vaccinated people have children at home that are not vaccinated, and some are babies and some are older than that. But so I am concerned about those staff members who have that. Also, I've been hearing that many towns are going to requiring masks indoors again. One thing I have noticed is that staff that are not vaccinated have been a little lax with their masks now, which is also concerning. So these are the things. I heard you say you don't meet for a month. I don't know if that's accurate or not, but I'm concerned with our health director leaving. And if you're not planning to meet, what guidance are we supposed to be following at the town hall?
Thanks, Jody. Jeff, would you like to speak to this right now? I do see people, I have your comments coming up. We will get to them. Right now we'll talk about this issue and Jeff's recommendations.
So we are seeing an uptick in cases. That's pretty clear. And the state's current recommendation is that unvaccinated people and vaccinated people wear masks indoors, but it's not a requirement. If we are seeing more cases and we're starting to see it kind of close in on us again, it may not be a bad idea to consider having masks for those meetings, in public meetings, where they're indoors.
How long did they extend our ability to meet remotely? Was that and or hybridly? If that's a word. Jody?
So the governor's offices and state legislators agreed to allow us to meet remotely through April of 2022. I think there are many boards who felt it was important to get back in person. And I'm just concerned that we are taking risks with not only officials, but staffs, themselves and their families by doing this with the Delta variant and what we know.
Thank you, Jody. Sue.
So I would actually support what Jody is saying. I think if people want to come to a meeting, I would support them having to be masked. And otherwise, they can join the meeting remotely. I think, Jody, that's what you're saying. You're going to have that hybrid model. So if you choose to come in person, just like, I wish I didn't have to wear a mask. I feel like I'm vaccinated, et cetera, but there's a lot of places I go into that they still require it. Every doctor's office, every place you go that has anything to do medically, you have to wear a mask. I have no problem with what your suggestion, Jody. I think the people have that option. If they don't want to put a mask on, that they can stay home and take part in the meeting remotely. So I absolutely support what you're saying, Jody.
And for what it's worth, I work in the biotechnology arena. And all of the companies that I am working with now are returning to wearing a mask in an indoor setting.
Yeah, and a lot of businesses. And I mean, yeah. So do we as a board, would you like us, Jody, then, and Jeff, should we be making?
So I think maybe the thing is that you make a recommendation as a board to wear masks in meetings for public meetings at this point. I think that could be one separate recommendation. Additionally, I know people are here for obviously concerned about school-age kids going into school and what their requirements are going to be. I think that could be a separate one, but they should probably be similar in direction.
Stephanie, can I just make a comment?
Yes, Zach. And then
Through my work, I've been talking to a lot of HVAC engineers. Basically, the American Society, I forget what it's called, ASHRAE, which is American Society for Heating, Refrigeration, Cooling, so forth. Their COVID requirements came out, and a lot of building engineers adopted them. But the basics of it are that most buildings let in about 10% fresh air as part of their HVAC systems. And the ASHRAE updated their guidelines to let in more fresh air, so about 20 to 30%. I've been in the construction trade for years, and I know that in many buildings, it's not as accurate as, or even done as well as we should in terms of letting in fresh outdoor air. So that was one of the requirements, and I don't know in all of our buildings in town if that's been met. The second part of their requirements was to add filters when feasible. In many of the buildings in town, I don't know if we even have filters. So that part of it, which I think is a huge part and a very important part, if it wasn't feasible, then the building custodians and whoever runs the system was like, well, I can't put a filter where there is no place to put a filter, so I followed the guidelines. I feel this is actually one of the best ways to make a building safe, is to bring in fresh air and to filter the air. But I'm not an expert on the buildings in town. I don't know which buildings have that ability and which ones don't. My recommendation would be, whenever possible, to bring in room filters. HEPA filters. They're fairly inexpensive. You can size them to the appropriate size for the room you're meeting in. I know there would be an expense to it, but that way you could bring in HEPA filters. You could also bring in UV filters into each room, which not only would make a difference, but would also make people feel a lot safer. I don't know how much the town's looked into it. I'm not sure if this is appropriate guidance from the Board of Health, but I'm just saying that we all kind of relied on ASHRAE, and even though their guidance makes a lot of sense, it really does depend on each building, and I don't know that most people know what each building is able to provide.
thank you, Zach. I know that personally, from the things that I have been hearing and reading, I am definitely concerned about the rate and the ease that the Delta variant spreads, and that it is the dominant variant at this point, and that meeting in close, crowded rooms, frequently in older buildings that we have, I see the concern.
Can I just add one thing, Stephanie?
Sure.
I just feel that wearing a mask is probably one of the easiest public health interventions we actually have. And I don't know how long COVID's going to be a factor in our lives, but it doesn't appear that it's going away quickly anytime soon. And we are coming up to the season where we are going to be back in buildings, locked up tighter than usual with windows closed again. And as much as I do agree with Zach, maybe a mask for when you know you're going to be in a densely packed area is not a bad requirement. It's one thing that we can watch on a regular basis. We can monitor cases, and if we see that there's no effective change, it may be something that could be changed. I mean, really taking a mask off is very quick. It's easy to do. So it may not be a bad option. The other thing, as far as schools go, is I do know that we're still only dealing with about 3 weeks worth of data right now, and it is changing extraordinarily quickly. And we're seeing numbers jump on a regular basis. I know the school department is having a meeting, I want to say the week of the 23rd, and it may be worthwhile having a second meeting prior to school opening that week to see where we stand on wearing masks. It may just as we gather more data, and this is obviously snowballing quickly for all of us. And there's people on both sides of the aisle on wearing a mask or not. It may be worth just gathering a hair more data to see what we really want to do.
Yeah, thank you, Jeff. And a couple of things that I'm seeing. So Jody, you mentioned, that we generally meet once a month, but during COVID, we've met much more frequently as needed. And, if we need to meet more frequently, to be flexible, because I think that's one of the main pieces with COVID is that it's constantly changing, and we do have to be ready to change to what the best thing for the population is at the time. And Jody did note that they bought high-powered filters for all offices and buildings about 9 months ago, to what Zach was saying. So I guess before we start talking about the school piece, how does the board feel about requiring masks for in-person attendance is it just in town meetings? Is it in town offices? What do people think?
Stephanie?
Yes, Sue.
One of the things that we also don't know at this point in time is who is vaccinated and who's not. Okay. I mean, we still have the right to not get vaccinated. So I think I just really support the public meetings for people being masked, because we don't know who is vaccinated and who's not vaccinated. So to me, again, if you choose to be at a meeting, we're just asking you to put a mask on. And if you are not willing to do that, you can still be part of the meeting, but you should be doing it from home. So that's how I feel. That would be my position as a board member on how I would feel about offices. Again, when we think about in an office, are we sitting on top of each other? Typically, we still have that distance that we can adhere to, about the 6 foot distance, right? So, I think it's more about the meetings that cause the issue with a lot of people in a closed space.
Okay, so rather than in our public buildings, you would say just for our public meetings.
That's just my opinion. Yeah.
All right. Would you like to make a motion? Is there any other further discussion from board members on this?
I just want to say, having served on a board for years and years, I was actually surprised at how well remote works, and the fact that, I was looking forward to getting back in person with everybody, but the fact that we're having the variant and the spike again, I would just wonder, Jody, if it does make sense to go back to remote for the time being. I know you're doing a hybrid of that, just because on a meeting that's highly attended, you are putting a lot of people in a smaller space, and it would probably just reduce risk altogether if we could go remote. Now, I don't know what your feedback has been in terms of residents of the town, but it does, to me, I've been surprised that it's actually, I think, given more access to a lot of meetings, because you can attend virtually. You don't have to get yourself down to wherever the meeting's taking place.
And just as an aside from the discussion, Jeff, with the comments coming through the chat, I believe we do have to read those into the record. Is that correct?
Yes.
Okay, so for those of you who are commenting in the chat, I will be reading all these comments into the record, if that changes anything that people are saying. Okay, so back to, and I see a hand up from Melissa McKay. Is your comment, if your comment is not pertinent to this particular discussion, please take your hand down and then put it back up. If it is about this, leave it.
Yes, I think it is. I think it's pertinent.
Okay.
Regarding
if it was about schools or if it was about town meetings.
No, regarding the masking in public buildings.
Okay.
Right. So, my name is Melissa Mackey, and I am a clinical laboratory scientist at Lowell General Hospital. I would like to say that we do not wear masks in the hospital. If I'm not patient forward. If you're facing patients, you will wear a mask, but we all work in a lab. We don't wear masks. I don't know if that helps Jody at all. I would like to comment that I think it's really important that we shift the tone and framing of our COVID conversation to one that focuses on severity of illness instead of case counts, especially since it seems as though COVID will likely be endemic, meaning it will come around every year, especially during cold and flu season. And I think we would benefit from a reminder of the initial goals of our mitigation efforts, which was protect the healthcare system and decrease and protect our vulnerable adults. And until we have a vaccine available, and we have thankfully reached that point. Someone was mentioning earlier how those who are vaccinated, I think it was Joanne, we're not seeing severe illness with them. And while cases may be rising, hospitalizations are currently low, and so are deaths, some of the lowest that we've seen since the beginning of the pandemic. It seems as though the new goal is zero cases, and zero transmission. And I think this is an unattainable goal that will leave us in this never-ending cycle of mitigation strategies with no apparent off-ramp. Thank you.
Thank you. Appreciate those comments. Okay.
Jody's got her hand up.
Stephanie,
Yes.
This is Joanne. And I realize it's a little different on Zoom, but if we were all in person, we just have to remind people that they have to, say who they are, where they live, and why they're participating, so that we have that on the record as well.
Thank you. Yes. Melissa, would you like to add where you live?
Yes, Melissa Mackey, 12 Fletcher Road.
Thank you.
Stephanie, we have Jody who's looking to come back on.
Okay, Jody. Sorry, yeah, because I only see a few people.
Thank you. So I think that boards are looking for direction from your board. So I think your recommendations are important. And I agree with Zach. We found that there was much higher participation in remote meetings, but I think there's certainly people that missed being in the same room together. So, it's my goal to not have even one person get sick or bring something home to their family member. So I think that would be great if you provide us with that direction. And if a board vehemently disagrees, then they can meet and all be masked. But I think we need to protect our public. So thank you.
Thank you. So my thinking, and board members, please chime in if we want to get to a resolution on this, but I feel that because of the current rapid increase and risk factors associated with particularly the Delta variant and how that's impacting people and the number of people who might take it home to unvaccinated or at-risk family members, that requiring masks to be worn for in-person attendance at a public meeting is a reasonable requirement.
Yeah, I'm going to agree with you, Stephanie. I'm not, a big favor of mandates, but in this case, the fact that we don't know who's vaccinated and who isn't, and unless we have some amazing new system that I haven't heard of to see who is, if we're going to have a public meeting, then we're going to have to expect that some of those people aren't vaccinated. And so asking that everyone wear a mask, I think, is a perfectly reasonable requirement.
Absolutely agree.
I agree, Zach.
I agree with that too. And if you're watching what's happening out there, we're dealing with the Delta variant right at this moment, but there's another one and we're watching it carefully. So we're lucky here in the Northeast, and especially in Massachusetts, but if you look at the rest of the country, it's not so good. And I think we have to really be honest and look at last summer when we were in a good shape, and then the fall was not good. So I totally agree, and I think we need to get in front of this.
Thank you. And I think what will assure people is that we will stay very aware of what the situation is and very flexible about mandates and requirements. That, if we see that it's not necessary, we're not going to leave things in place any longer than they need to be left in place. Is there somebody then who would like to make that motion?
I'll make the motion. I think what we're doing, though, is we're not requiring, right? We're recommending. Is that correct?
Well, it's already recommended by the governor, right? That everybody wear them in closed indoors.
Okay. So Jody, do we have a right to say we mandate in public meetings that that you have to wear masks?
Yes.
Yeah, Belmont just passed it for all
Okay.
of Denver.
Yeah. Oh, yeah. We absolutely do.
Okay, all right, then I'll make that motion.
As long as, I'm sorry to interject, we do have the ability to do the hybrid model like we've been doing.
Right.
So they can attend masked or be at home on Zoom. So that no one is, when we're not precluding anybody from participating.
Yep.
So
I'll make that motion that any public meeting, we will be mandating wearing masks if you're in person, and if you're unable to do so, that you attend the meeting remotely.
thank you. Any further discussion? Somebody willing to second that?
I'll second it.
I'll second it.
Okay.
I
Joanne
beat you,
got the second in. All in favor? All in favor, say aye.
Aye.
Aye. So is that Joanne and
Yes. Yep.
Michelle, yes?
Yes.
Yes, okay.
Yeah, yeah.
Great,
I
so
had
that
to unmute.
motion passes unanimously. Sorry. Scrolling people. Okay. Jeff, should I then read in the comments that have been made?
Yeah, I think you could do that now if you wish to.
Okay,
It looks like there's a bit of a conversation going on in there as well.
right.
Stephanie, can I just ask, or maybe Jeff, I'll just ask, would it make more sense to type them into the meeting minutes?
And I'm sorry to interrupt. This
Sure,
is
Jody, how do we need to do this?
And then I'm signing off, but you do not have to read them. You can publish them after, as Zach suggested, you
Okay.
can publish them after the meeting. You don't have to read them, so.
Okay, and are we able to print them out and save them?
Yep.
Okay.
Yep, but the select board does it all the time. They don't read
Okay.
them. But anyway, thank you so much. I'm getting off.
All right, thank you.
Thanks, Jody.
Thanks,
Bye.
Jody.
So again, I guess the next sort of issue that we know people are concerned about is the question about schools and masks.
Can I just make a comment, Stephanie? I mean, we all know this. Anyone who's has kids or has friends with kids knows that it's been really difficult for teaching in person with masks for kids, and it has a lot. I hear what everyone's saying. There's obviously no easy answer here, but as opposed to a public meeting where there's mainly adults going and they are there for a couple hours, school is 8 hours a day, and it's long and hard as it is. Now adding masks, as we have seen, causes a lot of stress and makes learning harder, and so I'm not sure where I sit on masks, because I think it's changing day to day depending on what's going on. This is, to me, has a lot more detriments that we have to be aware of. And I really appreciated Melissa's comments that if we're looking to get to zero, then we're going to mask kids forever. And I was a big proponent of masks when this all first started. You can go back and watch the very first meeting when we talked about it, and I said, if we look at the data from Asia, masks are making a difference, and they do make a difference, but they also have a price. And I don't know what the price is yet, because we haven't had enough time to study it to see what the mental health issues are and the social issues are. So I just, as we're discussing this, I just want us to be open enough to know that we don't have all the answers. I mean, we've all been, following this for over a year, and we've been trying to get the best data and so forth, but this is one of those data points that none of us have, and it's not going to be an easy answer. So I just want to make sure that our tone when we're talking to each other, I mean, I know the board members, we all get along, we talk really great, but I just want to make sure that the community knows that we don't have the answers, and we're not trying to tell you that we do have the answers. We're trying to come at some solution or a compromise that makes the most sense for the community with the data that we have at the moment, and it's probably going to keep changing as we go.
Thank you, Zach. That expresses very well what I also feel.
And if I can, this is Joanne.
Joanne.
And I hear exactly what you're saying, Zach, but I also know that it gets kids back into school. Back in the beginning and all of this, schools were shut down. Everything was done remotely. And that, I think, and again, we don't know everything, but, when you need to compare being at least able to be in the classroom, to be back socializing with the kids with their friends, the teachers that are there that they can actually instruct, as opposed to doing everything virtual and on computers and all of that. There is obviously, that's a much better, I don't want to say solution, but circumstance to be back in the classroom masked as to being home all by yourself. So, it's not perfect, and we're in the middle of a terrible situation right now. But if we can get the kids back at least into the classroom, and if in order to do that, it's they need to wear a mask to protect each other and those at home. That may be a temporary solution until we can get a handle on this. Because again, and I understand that it's just like H1N1, it becomes part of our regular routine, but we're not there yet. But my other comment is, like you said, this is a moving target. And we haven't heard from DESE yet and what they're gonna come out with. And, I think we need to, like Jeff said, it's only a couple of weeks. I think we need to maybe wait another week or two. We'll be flexible. We'll meet again and again, like we did before, and until we get, a better handle on it. I don't think, personally, I don't feel I'm in any position to take a stand one way or the other. I'm interested in the dialogue, but, on August 9th, I don't think we have the answer.
Thank you, Joanne. Do any other board members have?
Again, Joanne, really good point that, remote learning also had its cost to mental health and to learning. So you're absolutely right. And that's what I'm saying, there's no easy answer to this, because even if we said, okay, you don't have to wear masks, and that meant that a lot of kids stayed home, there would be a cost to that as well. So, I really do think having a discussion about this is important, and I'm not prepared, just like you aren't, Joanne, tonight to make that decision. It wasn't on the agenda. I don't think it's fair to the town to make that vote tonight, because it wasn't, there are people here tonight, but there are a lot of people who weren't here tonight because it wasn't on our agenda. We were just getting basically a COVID-19 update. I think if we're going to discuss this, to mandate or not mandate, it should be on the agenda so that the whole town knows about it.
Thanks, Zach.
Definitely. Yeah. So I totally agree with Zach and Joanne about everything and not making decisions right away. I do feel like I hate to see the kids having to be back in masks, but I think about the fact that until we know more, how can we say that the young, the CDC is recommending that if you're unvaccinated, and everybody that's in elementary school is unvaccinated. So I really want to see the kids back in school. That's my biggest priority. And I want them back full. If it means at the beginning they might have to be masked, so be it. But I agree wholeheartedly with Joanne that today is only August 9th. And we do need to wait and see what DESE has to recommend. And I am grateful that our town, yes, the numbers are rising, but in Massachusetts, we have been very fortunate that, kids have not been getting really sick with COVID, but we want to make sure that we don't go backwards, and I certainly don't ever want to see schools closed down again. We know what that did meant, the mental health of children, and that would be the biggest disaster ever. So at this point in time, I agree with everybody that we should not be making a decision right now about this. And it is a great thing to be discussing it, and that everything we do has to be for the best interest of the students and the staff, that everybody's going to be safe. And I am so grateful for what Melissa said, because we will never get down to zero, and we don't close schools down for the flu and things like that. So I agree with everything you say, Melissa. And I have such mixed emotions about, I can't believe we're still talking about that COVID right now. I thought the fall we were going to be free and easy. So I'm praying that we get things under control and that more and more people get vaccinated. I do believe that is the answer. And that's the nurse in me that believes that is the answer. But until we have more people vaccinated, until we know more, we shouldn't be making any decisions.
Thanks, Sue. Jeff, did you say that that there was a school committee meeting soon that they would like a recommendation for?
Yeah, I think they're going to have a school committee meeting as early as maybe tomorrow. And I believe they're going to try to meet a second time the week of the 23rd. And what my recommendation for you as a board to do would be maybe to meet jointly with them. So you can meet and make the decision on what you would like to do that week.
Okay, thank you.
Do we know when DESI's recommendations are coming out? Anybody know?
The school committee meets August 16th.
We do have some people with their hands up.
Right. I was going to ask first for, I think it was Catherine Clear, followed by Melissa Mackey, then Chris Chu.
Yes.
Hi, everyone. Sorry, my camera is not working, so apologies for being off screen.
I just create your name and address.
Yes, it's Catherine Clear, 14 Sawmill Drive. This kind of pertains to an earlier part of the conversation, and I did post in the comments, but I think it also does kind of pertain to, I know we're talking about schools. When we are talking about the quarantine, 10 days versus 8 days, or testing symptoms and what are close contacts, does that change if the contact, say, is masked or you are masked, or is that regardless? Does that say if people are masked or unmasked, basically?
Jeff, did you want to answer, or Sue, or?
You want?
Oh, I'm sorry. I've got people texting.
Okay. Sue or Joanne?
Yeah, so masks, in terms of doing contact tracing, masks are really not part of the equation, only because we know that there are different types of masks and people wear them incorrectly. They could, have them on their chin and say, I have a mask on. So in terms of contact tracing, that is one thing that isn't as up there in the importance. We don't take that into consideration. They do their job if they're worn correctly, and they help mitigate, but they are not, they're not going to be helpful if they're worn incorrectly or not a good product or something like that. So that we can't take that into consideration.
Thank you.
And so that would say the same if you were in a classroom setting as well.
Correct.
Okay. Thank you.
Thank you. Melissa?
Hi, yes, Melissa Mackey, 12 Fletcher Road. So I just saw this board recommend masking at indoor meetings with no metrics, little to no data to support that. So as a parent with 3 young children in school who feel masking hinders my children's ability to appropriately access their education in a developmentally appropriate way, I am asking that we use data from direct evidence-based metrics before we put any mitigation strategy in place at all. We need guidelines, because otherwise we're just using emotion to make our choices. And the first casualty of emotion is reason. We need to have metrics before we make choices like this. Thank you.
Thank you, Melissa. I appreciate that. But at the same time, I would also say that unfortunately, because COVID is changing so rapidly, sometimes we are having to operate under the best understanding and thus be flexible, because we really don't have the metrics fast enough to make the proper decisions.
Well, we have the metrics that there's 20 cases in town, and we have a lot of incoming data from other places besides our own. And so we really need to tease that out, and we need to be able to separate those sort of things, what we're hearing from everywhere else and what's actually happening here in our town, because this is our children and our schools.
Thank you.
And we need to have metrics.
Okay, appreciate that. Okay, and Christopher Chu.
Hello, hi, I'm Chris Chu. I'm the superintendent of schools here in Westford. I'm not a resident. Thank you for letting me speak though for a second. I raised my hand initially when there were some questions about the next meeting. And so that was answered. Yes, the next school committee meeting is on August 16th. And in conversations with Jeff Stevens, we've talked about the idea of waiting until the week of the 23rd to make our decision in response to the DESE guidance of July 30th. And so that I would encourage that if it's possible for us to have a joint meeting of the school committee and the Board of Health on the evening of the 24th. We had said the 24th because I believe that there's a regular update on Tuesday mornings, maybe from DPH specifically. So we had talked about rather than doing something on the evening of the 23rd, and then if there was potentially different information on the 24th, to just have that meeting on the evening of the 24th. So I just wanted to say to everybody that I would strongly recommend that we do that we wait till that week, and that if we could bring the two boards together, I think it could be incredibly helpful for the conversation. That was all.
Thank you. I appreciate that. So I think the board members have pretty much already kind of indicated that we all feel waiting is important because the data is changing so rapidly. I am not able to make an August 24th meeting. Do we have enough board members who can?
I can be there.
Okay. I'm not seeing anybody else. Hold on. Michelle, are you able to?
What day of the week is that?
So
Tuesday.
Tuesday?
Tuesday? I should be able to make that.
Zach?
I can make that, yep.
Okay. And Joanne, it's Tuesday's bad for you, right?
Yeah, but I should be able to. And the meeting, the DPH call is in the afternoon on Tuesday. So, to the comment, we might hear something that day.
Right. Okay. So I guess then do we need to do anything to meet that day? Do we have to, Jeff?
Well, what I'll do is I will make sure that I talk with Dr. Chu, and then we'll post the meeting jointly.
Okay.
And we'll post it in enough time to make sure that we can have, and boy, you guys are going to work me to the bone right to the last day. I'll try to make sure I have as much data as I can pull together on not only what our local data is, but whatever I can pull out of the state for good metrics, which I fully support in using.
Thank you. I wish I would be able to say I could submit stuff, but I will be in Hawaii and I don't know.
Oh, wow.
So, but it's very important. So, okay. So we will.
You can remote in from the beach.
I actually think I might be on the airplane. Well, I'm not sure where I am quite on the 24th. Okay, so we will plan then to join with the school committee meeting.
On the 24th, and I'll work with school department staff in pulling together as much data as we can get and get it to both boards as fast as we can, so you have time to really look at it and process it prior to the meeting.
Thank you. And
that meeting will, for at least our Board of Health purposes, be for just this and just this only. I won't put anything else on the agenda.
Okay, great. And then I guess with that, we have the department correspondence and report on FDA grant awards.
Let me get back to that screen. I've got a few things opened here.
And thank you, everybody, for your comments. I was reading them. I've seen them. It is we all care very much about this, and it is a very difficult thing to balance all the different risks and concerns. And we are very, I think all of us, very aware and very sensitive to all of the different concerns.
And I have got it saved. I've got the entire chat saved into my computer, so I'll be able to pull that up and give it to our minute taker. And I'll do it one more time. So if anybody has anything to add at the end, I'll do that as well. So The last correspondence I have is, as all of you know, our department has been very much involved in the retail program standards for food. And we just received another set of grants that we wrote, particularly Ray wrote these, for additional training, more equipment, and further plan review skills, and which is going to get not only our current staff trained, but new staff that we're now going to be bringing in to get trained up as well, which brings our total for the year is well over 40,000 out of the Food and Drug Administration for our food safety retail program.
That's great.
Yeah, it's a fairly significant amount of money. I don't know of any other department that's gotten as much as we have over the past year.
That's terrific. Thank you.
I did know the staff wanted all of you to know that we're building some fairly comprehensive training kits and toolkits for people to take out into the field. So when they're really going through the restaurants, they can really make sure everybody's adhering to all of the retail program standards as tightly as they can.
That's terrific. Thanks, Jeff. I think we're left with discussing whether, do we need to discuss here and now appointing someone to fill in when Jeff leaves?
Yeah, I wanted to ask Stephanie and Jeff your thoughts. I wish that Ray were here tonight, but I'm assuming you've had a chance to maybe discuss with her possibly taking over an interim position for a temporary time. Is that something you guys have discussed?
I know she's brought it up to me. I have certainly discussed it with her. If she's somebody that you wanted to bring on as the interim health director while you either go out to look for a new candidate or maybe even consider her, she would be my recommendation. I think she's got the tools and the skills and has worked extremely hard over the past 15 years that she's got in Westford to make that progression the ladder. So that would be my recommendation. After that, I think I should stay out of that process to an extent. But I would probably recommend forming a 2-person committee to make the recommendation on who you would like for the interim. And then what I'll do is I've requested that the job description be sent to all of you, which you should have, I would imagine, tomorrow. So you can look at it, see if there are things in the health director's job description you'd want to update. I know we did do that around 4 years ago, but that is 4 years. It may be other things you want to add in. And then move forward from there. It's kind of an awkward spot for me to be in to talk about what you need to do next.
I know, and I'm going to make it even more awkward, Jeff. I'm going to ask, I think that as part of this discussion that we're going to have, we're going to need to also talk about the pay. And I don't know, I mean, I can't remember the last time we looked at that pay band. So I'm not sure if it's appropriate or not, or if it needs to be adjusted. But I think that that's something that we're going to need to look at as a board as well to make sure that we get the most qualified candidates. So I don't know if we need to kind of look at a market basket of towns, or if the what's the name of the board, the pay band classification board, I can't remember their official title, if they're doing that on a regular basis. So maybe it'd be appropriate for us to reach out to whoever's in charge of that in town to, just have that as part of our discussion at whatever meeting that's at.
Yeah, I think that, I would be for, I'd be for anybody getting more money. So it's not too awkward for me, Zach. So if you can pay the next person more money, I'm glad I was able to.
It's kind of a silly process that we only talk about it when someone leaves the position. We should probably be talking about it more proactively. I guess my recommendation to the board, just having thought about it for a couple of days, was that if Ray seems available, and I'm happy to talk to her with you, Stephanie, if you'd like, if she's available to take that on, because it is a big responsibility, that I would think she'd be the perfect choice as an interim. That would buy us a little more time to do a better, hiring process, so that we don't feel rushed.
I agree with that. We should also talk about what we will be doing to backfill Ray's responsibilities while she is acting as interim director.
Right.
Yeah, do we ever, how does that usually happen?
So you've got, obviously, there's 2 positions in the office that will need to be filled. The first one of them will be the admin position, which is, in my opinion, the number 1 position to be filled, because I'm spending a lot of time doing things like payroll and just doing the day-to-day office activities. And I think that position should be filled by the staff as soon as it can. Additionally, maybe we need to have a consultant available for some Title V work. And that may be something the board wants to ask for, to make sure that if they're getting overwhelmed in the office, you can make sure you can call somebody in to help out and just kind of lighten the load.
Yeah, we've done that in the past where we've had someone kind of ready in the wings, a consultant to come in and just help with plan review and things like that. Because I'm assuming that would be one of Ray's jobs that would be hard for her to do both of. But I'm not sure. You'd have to let me know, or Ray would have to let us know.
Yeah, I think that would be, if you choose to use Ray as the interim person, that would be maybe a good conversation with her on how she would like to handle that.
Okay.
So this is Joanne. I would suggest maybe, having the 3 of you sit down and map out a plan, not necessarily like during the board meeting, but, just talk out those specifics and then see which is what's the best way forward. But I agree. I think, Laurie's position needs to get filled ASAP.
So Zach, you sound like maybe you're willing to be part of this committee?
Yeah, I'd be happy to, especially if we could do it remotely. Like if we could remote into the office, that would be great.
Is there anybody else who would like to?
Is that too many then? No.
We can have 2.
We can have 2.
Does it need to be me? I'm happy. I'm willing to do it. I just didn't know if there was somebody else who felt strongly about being involved.
Well, I'd be happy to do it if, it's up to you. Stephanie, if you want to be involved, and if not, I'll be happy.
Well, the only hesitation I have is that I'm going to be gone, leaving Thursday and not returning until the 25th.
Okay, I'll do it. Why don't I do it with Zach then?
Okay. Thank you, Sue and Zach.
No problem. Sue, so I'll, we'll email Jeff and Ray and figure out some times.
Okay, sounds good.
All right, so I think what you'll be looking to do, just so it's clear, that effective September 2nd, you would be, if Ray is amenable to it, and I think you technically still have to ask her, you can't appoint her. You could say, no, I'm not doing this. But I don't think that's the case. But I think your effective date will be September 2nd, when she would be taking over.
Okay.
Since this may be our last meeting before then, in which, because we'll have the school committee meeting, but I assume we won't be talking about this. Does it make any sense to make some kind of motion that says that if Ray is amenable, that we would be placing her in that position?
I think that's a good idea.
And if she says no, we can always, scramble, but.
Okay, so.
So I'll make a motion that if Ray Dick is available and amenable to being the interim health director for Westford, that she be appointed starting September 2nd.
I'll second that motion.
Okay. All in favor, say aye.
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 Great, thank you. I got everyone. That was unanimous. Okay, and all right, so Sue and Zach will work with that, and I guess is there any other old business then?
The only other business I have is I just want to thank you all for the great time I've had working with all of you. It's been an absolutely unbelievable ride from the asphalt plant to COVID. We've seen some very interesting things over the past 6 years, and I can't imagine going through it with a better group of people. So I will miss all of you very much.
We will miss you.
We'll miss
We're going to miss you too, Jeff.
Yeah, good luck, Jeff, with your new position.
But we know where you are.
Yeah.
I'm not going to be hard to find.
All right. Well, do we have a motion to adjourn?
Make the motion.
Motion made. Is there a second?
Second.
Motion. Okay, that was Michelle who seconded. All in favor, say aye.
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 Last meeting, Jeff. Bye. Oh, no, it's not. We
No.
meet again.
There'll technically be one more, but this is the last official Board of Health meeting. It's not a joint meeting, so.
I'll try to get my camera fixed before the next one.
All right.
Good night, everyone.
All right. Good night.
Good night.
everybody.
Good night.
Night.
And the chat is saved.
Thank you.
All right, I will stop recording and disconnect now.
Recording stopped.